Good afternoon, everyone. Hi, I'm Liz Krueger, State Senator for the 28th District. Welcome. This afternoon's formal discussion will be about Medicare Parts A, B, C, and D, changes you can make to your coverage now. As always, we have closed captions of today's event. You have to activate closed captioning to view the text on your device. If you're in Zoom, click on live transcript in the meeting controls to start viewing closed captioning. And if you're on Facebook Live, you'll see a settings button in the bottom right-hand corner of the video. Click on CC for closed captioning to be activated and to be able to have text that you read along with what we're hearing. This forum is being recorded, and everyone who RSVP'd will receive an email with links to the event video and event survey and the resources that are posted in the chat within a few days, along with our presenters' very informative PowerPoint. So don't panic that you have to write down everything you're hearing, because we're going to give it to you all afterwards as well. Before we begin today's program, I'd like to give you a brief COVID update. New strains of the coronavirus continue to circulate in the community. With the colder weather and holiday season approaching, this is the time to get the updated 23-24 COVID-19 vaccine to maximize your protection against severe health outcomes. It's also a really good time to get vaccinated against the flu and RSV to help stay healthy. RSV for people over 60. Or I think for pregnant women, they're being recommended now. And again, even though you hear that people can still get COVID if they have these new vaccines, they get much less serious versions. And that's what you want to do. You want to avoid having to be hospitalized with any kind of illness. So I can't emphasize enough how strongly I feel that people should go ahead and get vaccinated, unless for some reason their doctor is saying that they're an exception to the rule and should think about this in a different way. So now moving on to today's event. Today we're going to hear from Eric Hausman, who's the Volunteer Outreach Manager, New York City Department for the Aging's Health Insurance Information and Counseling Program. I bet that doesn't even fit in a business card, but we just know him as Eric from HIICAP, who knows everything about health insurance for seniors. He's an expert on all things Medicare and has a major following among my constituents. He's sort of like the rock star of information on health insurance for older New Yorkers. Eric will provide us with information about changes coming in 2024 to premium rates and deductibles for Medicare Parts A and B, and changes to Part D prescription drug coverage. Additionally, you will learn about Medicare Advantage and supplemental programs and plans that can help defray Medicare costs, including drug prescription costs. And Eric will talk to you about why this year we have several companies who have been providing Medicare Advantage insurance programs, plans that are actually dropping out for Manhattan. So if you might have heard that your plan isn't going to continue, it's very, very important that you stay on top of what your new options are and what would be in your best interest. We received a large number of questions already, and I'm certain we will get additional questions submitted during the event. Eric will answer as many general questions as time allows. We will not be able to answer specific questions about your individual coverage, but for specific questions, or if you've submitted a general question that we are unable to get to today, you can call HIICAP, Health Insurance Information Counseling and Assistance Program, and their phone number, and it'll be in the chat, and that one you might want to write down, is 212-602-4180. 212-602-4180. The number and the website will be listed in the chat. The town hall today is a general information session on Medicare, particularly designed for individuals who will turn 65 soon or are seeking to make change to their current Medicare coverage during the open enrollment period, which ends December 7th. So if you're listening, this may apply to you now, it may apply to you soon, or you may be facing a deadline that's important for you to know is very relevant for your current coverage. And with that, it's my pleasure to introduce Eric Hausman.
Okay, thank you. Good afternoon. I'm going to go ahead and share my slides.
Yes, and put your picture on also if you can.
Okay.
We have your voice, we don't have your picture, which isn't the end of the world. Are you still there, Eric?
Yes, I am. Just trying to get the picture. Very good.
Perfect. Okay, thank you. I'll see you at the
Okay.
other end.
Okay, thank you, Senator Krueger. So as you heard, I work at the New York City Department for the Aging with their HIICAP program. It's HIICAP, Health Insurance Information Counseling and Assistance Program. And we have volunteer counselors that help people with questions on Medicare and related health insurance. And if you or anybody in New York City has a Medicare question, you can call the phone number that Senator Krueger gave, or you can call the general number for the Department for the Aging, which is 212-AGING, AGING, NYC, which translates to the numbers on the bottom of the slide, 212-244-6469, and ask for HIICAP with any Medicare questions. So today I'm going to be giving a Medicare update. I'll tell you about things that changed this year in Medicare, things that are changing for 2024, and even for 2025. So let's get started.
Sorry to interrupt, Eric. We're seeing the notes version of your slides. If you could change the settings.
How is that?
That's great. Thank you.
Okay, so we're going to start with Medicare enrollment. And this is something that changed at the beginning of this year with the initial enrollment period. This is when people are first eligible for Medicare to enroll. It's a 7-month period. For most people, it's the 7 months surrounding the month of their entitlement. For most, the 7 months surrounding the month they turn 65. So that means the 3 months prior to the month they turn 65, the month they turn 65, the 3 months after that. If anybody enrolls in Medicare Part B, the medical insurance, in any of the 3 months prior to the month they turn 65, Part B starts the first of the month they turn 65. If they enroll the month they turn 65, Part B starts the first of the following month. But what changed this year is for people that enroll in the last 3 months of their initial enrollment period. Prior to this year, anybody that enrolled in the 3 months after they turned 65, their Part B did not start right away. Their Part B was actually delayed, and it started either 2 or 3 months later. But this year that changed, and there's no more delay. For people that are eligible beginning this year that enroll in any of the 3 months after the month they turn 65, instead of starting 2 or 3 months later, it simply starts Part B the first of the next month. Now, for those people that don't enroll during their initial enrollment period, they may have to wait till an annual period to sign up for Part B. It's called the general enrollment period. It's every year from January through March. If anybody signed up during the general enrollment period last year or one of the preceding years, Part B did not start right away. It did not start until July 1st of that year. But starting this year, if anybody signed up during the general enrollment period, there is no longer that delay. And if you sign up between January through March, in that period, Part B just starts the first of the next month. But what you still might have is a late enrollment penalty. To those people, again, that did not sign up during their initial enrollment period and sign up for Part B in a subsequent general enrollment period, they may be subject to a late enrollment penalty. The late enrollment penalty is 10% of that year's standard premium and I'll talk about the premium later, for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not a one-time penalty. You pay that for the rest of your life. Okay. So the only people that cannot sign up during the initial enrollment period and can sign up later without having to wait till the general enrollment period and without being subject to a late enrollment penalty are the people that qualify for what they call the special enrollment period. The special enrollment period is for people that are still working or are covered under a spouse who's still working when they first become Medicare eligible. It allows them to delay enrollment in Part B without penalty and sign up later while they're working or within a full 8 months following the month they're no longer covered through active employment. So let's say you're turning 65 at the end of the year, but you're still going to be covered under your spouse who's working for the city of New York. You can delay Part B without penalty and sign up later when your spouse is ready to retire using this special enrollment period. And that's very common for people that are still working or covered under a spouse who's still working, especially if they're working for a large employer where the employer insurance would be primary, their main insurance. They delay Part B to save the monthly premium and then sign up when their spouse retires later using the special enrollment period. Now, prior to this year, the only people that were able to delay Part B and sign up using the special enrollment period, again, were the people that were covered under their own or their spouse's active current employment at 65. But this year, they added some additional special enrollment periods for people with exceptional conditions, situations. One of them was for people that were misadvised by their health plan or their employer or former employer. So for instance, if somebody was told incorrectly by their former employer that they were covered under COBRA, that they can continue to delay without penalty, that they were covered under their, not their active employment, but their retiree plan, something like that, they can simply request this exceptional condition Part B special enrollment period, where they can enroll without having to wait till next year and without being subject to a penalty. So it's a protection, a new protection that began this year for people that delayed Part B because they were, again, misadvised by their employer or their representative of the employer. And if somebody is not able to document that, because they might not be able to document it, and perhaps they were just told that on the phone, they can accept written attestation, okay, about what you were told that caused you to delay enrollment. There's also a condition for the special enrollment period for people that are released from incarceration after 65. So prior to this year, anybody that was released from incarceration, although those individuals could have had A and B while they were in prison, most of them just had Part A, and they had to wait when they were released to enroll, and they were subject to a penalty. But if they're released from incarceration this year, they could enroll without having to wait and without being subject to the penalty in Medicare Part B. It could even be retroactive to when they were released from incarceration so that there would not be a gap in their health insurance coverage. And then another one that can be important, especially going forward, is for people that lost their Medicaid coverage. And I'm going to talk about Medicaid later in relation to Medicare, but this is for people, again, that they had Medicaid through the marketplace before 65. They became Medicare eligible, but they failed to enroll in Medicare Part B during their initial enrollment period. And at some point, their Medicaid coverage ends. Ordinarily, those people would need to wait to enroll in Part B, but this new special enrollment period allows them to enroll in Part B again without having to wait and without being subject to the penalty. And it can even be effective retroactive to when their Medicaid terminated, so that again, they would not have a gap in their health insurance coverage. And then there's a couple of special enrollment periods for emergency or disaster or other exceptional circumstances that prevented somebody from enrolling timely in Medicare Part B for situations that were beyond their control. All of these special enrollment periods are listed on the form, which you have a link to, and you could use to apply to Social Security if you're enrolling using, again, one of these exceptional conditions. And then the next couple of slides are specific to retirees of the United States Postal Service, USPS. Now, federal retirees, including postal retirees, their situation is a little unique. Unlike most retirees, where their retiree coverage would never work without Medicare, federal retirees, their coverage actually does work without Medicare. Many federal retirees never sign up for Part B, and they continue to have the same federal coverage as when they were working, the same premiums, the same co-payments, but like any retiree, if they change their mind later, they have to wait till the next general enrollment period, and they're subject to the penalty. So what's new for postal retirees as of January 2025 within the Federal Employees Health Benefits Program, they're going to have a new Postal Service health benefits. And those individuals, though, that do not have Part B currently, they will not be required to enroll in Medicare Part B. That's the most important thing. They'll be grandfathered in. Okay, so if you're talking to a postal retiree that's in their 80s, that never signed up for Part B, they can continue to go as is. And their covered spouse and eligible family members with Medicare, the same thing. But if you're a retiree as of January 2025 and you're already enrolled in Part B, they're going to require you to remain in Part B to continue with this Postal Service health benefits coverage. So here's what it is. For active employees that are age 64 or older as of January 2025, again, they will be grandfathered in. They will not be required to enroll in Part B upon retirement. But if you're an active employee and you're under 64 as of that day, you will be required to enroll in Part B when you retire. For those that are retired on or after January 2025 and they're under 64, once they become 65 and Medicare eligible, they will have to enroll in Part B. Now, the exceptions to that are postal retirees that are living outside the United States and its territories, and for those that are veterans that have the VA healthcare benefits, but otherwise, they will be required to enroll in Part B for the people that are not grandfathered in. For the people that are grandfathered in, though, they're going to give them their own special enrollment period to encourage them to enroll in Part B. It's going to be a one-time 6-month period beginning in April next year through September, where they can enroll in Part B. It will not start until January 2025. They will have a penalty, but the big thing here is that the Postal Service will pay the penalty for them. They'll have to pay their own premium, but not the late enrollment penalty. And that will be an incentive for them to sign up. Now, a caution, I would say if you have somebody in their 80s that's a Postal Service retiree that never signed up for Part B, they don't want to sign up during the next general enrollment period because they'll have a penalty and they're going to have to pay it themselves. Instead, I would wait till April to sign up, okay, so that the Postal Service will pay the penalty for them. So the question is, why would you enroll in Part B, right, for those older Postal Service retirees if they're not required to do so? Well, one reason is that the Postal Service, the Federal Employee Health Benefit insurance company, might give you an incentive to do so, such as they may waive all the cost sharing. So that, especially for somebody with high medical costs, they might have 100% coverage if they take Part B with their federal plan. And that's something the individual federal insurer would have to confirm for you. Also, if they take Part B, that would allow the federal retiree to suspend, not drop their federal coverage, but to suspend, put it on hold to enroll in a low or no premium Medicare Advantage plan in order to save the FEHB premium. So some people for their FEHB coverage, they might be paying a couple of $100 a month. They might be eligible to enroll in a Medicare Advantage plan, but the only way to do that, to put their coverage on hold to save that premium, is if they have Medicare Part B. And that's the reason they may want to sign up for Part B, especially if the Postal Service is going to be paying that penalty for them. Now, so that you have more information, we have links here to fact sheets for Postal Service employees and one for retirees that talks about these changes and details. In the next section, I'll talk about original traditional Medicare. Now you recognize this. This is the red, white, and blue Medicare card, which shows you the two parts of Medicare. Medicare Part A, your hospital insurance, covers you if you need to be admitted to a hospital or a skilled nursing facility. Medicare Part B, your medical insurance, covering you mostly for doctor services and outpatient services at the hospital. Now, with Medicare Part B, there's an annual deductible. Next year, that's going up to $240. And that means the first $240 in covered medical expenses next year, that's your responsibility, unless you have other insurance to pay it for you. Besides the annual deductible, there's a monthly premium for Medicare Part B. Next year, the monthly premium will be increasing to $174.70. That's the standard premium. But there are some people that pay a higher premium because they have a higher income. And for next year, we're talking about people whose incomes are above $103,000 for a single, $206,000 for a married couple. So what are we talking about in terms of income? We're talking about their modified adjusted gross income. So to be exact, that's your adjusted gross income. Plus, if you have tax-exempt interest income, those two lines on your tax return added together define your modified adjusted gross income. And they're basing your premium on your modified adjusted gross income from 2 years ago. So for 2024, they're going to look at your 2022 tax return. And if your modified adjusted gross income from that year was above this threshold, you should expect a notice from Social Security next month that you're going to have to pay a higher Part B premium for 2024 based on your 2022 tax return. Now, if you're paying a higher Part B premium based on income, and you also have a Part D drug plan, which we'll talk about later, you'll pay an additional surcharge for your Part D drug coverage as well, based on income. It's paid in the same way as the Part B premium. If you're collecting Social Security, it'll be taken out of your monthly check. If not, it'll be billed to you directly. Now, besides a monthly premium for Part B and an annual deductible, on the Part A side, there are different costs that you're responsible for. Although most everyone gets Part A hospital insurance for free, for no premium, there's a large deductible if you need to be admitted to the hospital. So next year, for hospital admission of up to 60 days, Medicare will pay everything but the deductible. You see, it's going to be $1,632. If you're in the hospital beyond 60 days, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment. Next year, that's going to be $408. And again, that's per day for those additional 30 hospital days. If you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days, you're responsible for a daily copayment next year, $816. And again, that's per day. If you discharge from the hospital to a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full. The next 80 days, you're responsible for a daily copayment. Next year, you see it's going to be $204. And again, that's per day for those days 21 through 100 in a skilled nursing facility. Now, getting back to Medicare Part B. Medicare Part B covers mental health services. And currently, Medicare Part B only covers for mental health the services of a psychiatrist, an MD, a clinical psychologist, a PhD, or a social worker. But starting next year, they're going to expand the Medicare providers that are able to offer covered mental health services to include marriage and family therapists and mental health counselors. The marriage and family therapist and the mental health counselors that are enrolled in Medicare next year, same as the psychologist and the social workers, will be mandated to accept Medicare's assignment, meaning they will be mandated to accept whatever Medicare allows as their full payment, in which case your responsibility is only any unmet portion of that annual $240 deductible next year, plus the 20% coinsurance. Now, another Part B service that we get many questions about is physical therapy. Some of you may remember that at one time, Medicare had a dollar limit, a strict cap on physical, speech, and occupational therapy, but they eliminated that. And today, Medicare pays for therapy, physical therapy, as they pay for anything else, as often and for as long as is medically necessary. Now, although they no longer have a cap, a limit, Medicare does have $2 thresholds, where if you reach a certain amount in therapy for the year, the therapist needs to certify to Medicare that the services are still medically necessary. The first threshold for next year is $23.30. If you reach that threshold in 2024, the therapist just needs to append a code to the claim to certify to Medicare that the services are necessary. That's usually not too much of a barrier. But if you reach the second threshold, which is an even $3,000 and will remain that $3,000 for the next several years, this is a medical review threshold where Medicare tells your therapist that their claims in excess of $3,000 may be subject to an audit to make sure that the services are medically necessary. So some therapists, to avoid that potential audit from Medicare, treat that $3,000 as though it's an actual cap, a limit. And they'll say, oh, you've reached the limit for Medicare, you have to come back next year. You'll get a new limit. Well, although that's not exactly correct, then the therapist is not doing anything incorrect if they do not want to treat you in excess of the $3,000. It's always their decision to decide how they're going to treat people with Medicare and the services they're going to provide. But if you're running into that situation and you need therapy in excess of that threshold, I would simply recommend that if your therapist is not willing to provide it, that you find another Medicare participating therapist, because there are many in New York City, who may be willing to provide the services in excess of $3,000 because they feel that they're able to justify the medical necessity for that. Now, so far, I spoke about original traditional Medicare, and I spoke about gaps in coverage, deductibles, coinsurance. Now let's talk about filling in the gaps. Some people may have retiree health insurance from their own or their spouse's former employer or union that fills in all or most of the gaps in Medicare coverage. Others that have limited income and resources might have Medicaid in addition to Medicare, in which case Medicaid can fill the gaps. But for the people that don't have retiree health insurance and who don't qualify for Medicaid, they can purchase a private Medigap or Medicare supplement plan. I'm sure you've seen them advertised on TV from AARP. Just a little review about Medigap insurance. Medigap plans are identified by letter. There are 10 standard plans ranging from plan letter A to plan letter N. And the two most important things to know about Medigap insurance, one is that the benefits are standard. So different companies sell these plans and they charge different amounts, but as long as it's the same letter plan, doesn't matter what they're charging. It's exactly the same coverage. So it's well worth your while to shop around for the best deal on a Medigap plan. The other thing that's really important to know in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. And that means as long as you have Part A and Part B, you can, and you're on original Medicare, You can purchase a Medigap plan at any time at all. They can't limit you to only enrolling when you're first eligible or certain times of the year, not in New York. Not only that, if you have a Medigap plan already and you live in New York State, you could always switch, if not with the same insurer, by going to another insurer. You cannot be denied Medigap insurance in New York because of your age or your health. And that applies to people that are Medicare eligible due to age 65, as well as those that are eligible due to disability under 65. Now, although you can get a Medigap plan at any time in New York, what you may be subject to is a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So what that means is, although they'll sell you a plan at any time, they may not cover a service related to a pre-existing medical condition for up to that first 6 months. However, most people we meet are not subject to the waiting period because they've had some sort of prior credible coverage that can count towards that. And that could be most anything. It could be another Medigap plan, a Medicare Advantage plan, employer plan, retiree plan, COBRA, plan through the marketplace. So for instance, if you've been on a Medicare Advantage plan all year, but January 1st, you're going to be switching to original Medicare and a Medigap plan, you don't have to worry about pre-existing conditions. They will credit the time that you're on the Medicare Advantage plan this year towards satisfying the waiting period with the Medigap plan in the new year. If you want to see a listing of all the Medigap plans with a detailed description, as well as other details about Medicare and related health insurance, this is a link to our book, A Closer Look at Medicare and Related Health Benefits for New Yorkers, which you can download at this link. Within the book, you'll see a chart of the different Medigap plans that are available. These are the 10 standard plans, A through N. And I just want to point out something that changed a couple of years ago in regards to Plan C and Plan F. You notice C and F are the only two plans that cover that Part B deductible. That was the $240 deductible that I mentioned earlier. Those plans are only available for people that became Medicare eligible prior to 2020. So if you're first becoming 65 now, you do not have the right to purchase C or F. You can get D or G, which you see is the same plan, just doesn't cover the deductible. But the most comprehensive plan, C and F, those are only available for people that became Medicare eligible prior to 2020. So whenever I talk to people that are new to Medicare, that are just turning 65, I'll talk to them about Plan G instead, because that's the most comprehensive plan they can purchase. But Plan G can be expensive. If you're looking for the lowest cost Medigap plans possible, you'll notice that Plan F and G in this chart have an asterisk next to them. That's because there's a second version of the plans, a high deductible version. Covers everything the standard F or G covers, everything you see in this chart. But before they pay anything, you have to meet a deductible. Next year, the deductible is going up to $2,800. So if you have the high deductible F or G next year, that $1,632 Part A deductible would go towards the $2,800. The $240 Part B deductible, the 20% coinsurance would also go towards the $2,800. If you reach that $2,800, 100% coverage for the rest of the year, all the benefits of the standard F or G, while saving on the premium over the course of the year. Now, talking about the premiums, the Medigap insurers, AARP United Healthcare, has a premium rate increase, which will be effective January of next year. If you go to the New York State Department of Financial Services at the link on the top, you will get a complete listing of all the Medigap insurers, the plans that they offer, the waiting periods for pre-existing conditions, and the current rates. But if you want to see the new rates for January, you can click on the link below, which includes the AARP rate increases that are effective January. The other thing to note, when you go to the new rates, you won't see Empire, Blue Cross, and Blue Shield anymore. That's because Empire, Blue Cross, and Blue Shield stopped selling Medigap insurance to new members as of July this year. But these plans are what they call guaranteed renewable. So if you have a plan from Empire, you can, as long as you keep paying the premium, continue to have that forever. Since they're not adding new members, though, you might be well advised to look to see if another company is offering the same plan for less money. But if you have it from Empire, you can keep it. But if you want to get a new plan from Empire, you cannot, because they stopped selling plans to new members. Now, I want to talk to you about the Medicare Savings Program and Medicaid in relation to Medicare. The Medicare Savings Programs, for those that don't know, it pays the Medicare Part B premium. It puts that $164.90 this year back into your monthly Social Security check for those that qualify and apply. If you know somebody that has Part B and they're not paying the premium, they're already on the Medicare Savings Program. But if not, you might be eligible. The thing that happened this year in New York State, they increased tremendously the Medicare Savings Program limits. So if you look at the bottom of the slide, you'll see for last year, the income limits for this program were only up to $15.49 a month for a single. But this year it's up to $22.80, much higher. So there are many people in New York that did not qualify prior to this year, but do qualify today. And if you're eligible, you can apply at any time for this benefit. Our counselors at the Department for the Aging are all certified to do these applications. The other things to know about the Medicare Savings Program, even if your income is a little higher than the limit, you might still qualify because you're able to deduct other health insurance premiums from your income. So for instance, if you're paying $300 a month for the Medigap plan from AARP and your income's $2,500 a month, you could still be eligible because now your income is reduced by the cost of the Medigap premium and you can get this benefit. The other thing to know in New York is we don't have an asset or resource test for the Medicare Savings Program. They're only looking at income to qualify. So regardless of how much money you have in the bank, hey, if your incomes are below this amount, you are eligible. And then we speak to a lot of people that have Medicaid through the marketplace under 65, but are now becoming Medicare eligible. What should these individuals do? The most important thing for them to do is enroll in Medicare, Part A and Part B, when they're first eligible. Why? Because Medicare is becoming their primary insurance, and they cannot delay enrollment in Part B without penalty. If they're collecting Social Security, it'll be automatic, their enrollment, but if not, it's up to them to enroll. Now, these individuals, initially, when they first were doing this, they had to pay the Part B premium up front, and they were receiving later reimbursement for the Part B premium. They would receive a check from New York State. But what they did in February of this year, they replaced that reimbursement by just automatically enrolling them all in the QMB program, which pays the Part B premium. But the QMB doesn't start the first month they're eligible for Medicare. It starts the second month. So they're responsible for that first month of premium. So for instance, if you're somebody that has Medicaid now and you're becoming 65 in December and you enroll in Part A and Part B to start December 1st, you're going to be responsible for that first month of premium for December. But starting in January, automatically, you'll get the QMB program and the state will start paying the premium for you. And then what changed also was with the end of the public health emergency, they ended the easements and they went back to the recertifications. So prior to the public health emergency, people had to recertify annually to retain their Medicare Savings Program eligibility. They waived that during the public health emergency, but now if you receive the recertification, you need to return that, or you will lose the benefit. You will no longer continue to have that. The other thing they changed were these easements. Now, easements during the public health emergency made it easier for people to apply for the benefits. And the big one that they had during the public health emergency is that people were not required to collect Social Security to apply. Now, what New York State ordinarily does is New York State requires you, before applying for assistance for the Medicare Savings Program, that you access whatever income you're eligible for, including Social Security. Even though it might not be your full retirement age and you would get a reduced benefit, they do not allow people that want to apply for the Medicare Savings Program not to be collecting Social Security unless they're working full time. But otherwise, they need to be collecting Social Security in order to be considered for the Medicare Savings Program. So if you're delaying Social Security and you're not working, you cannot apply at this time. It was okay during the public health emergency, but it's not okay now. You need to be collecting Social Security to be eligible. So in the next section, we'll talk about Medicare Part D. D is for drug, the prescription drug coverage portion of Medicare. We have the new Medicare Part D numbers. Next year, plans can have deductibles of up to $545. Some plans have a $545 deductible, some have a lesser deductible, some have zero deductible. Once you meet the deductible, people usually pay a fixed copayment at the pharmacy until they get to what they call the coverage gap or the donut hole. That will begin next year at the point that you get to a little over $5,000 in total drug costs, regardless of how much you pay out of pocket up to that point. Doesn't matter. Once the total cost of your drugs gets to a little over $5,000, now you're in the coverage gap. At that point, you pay 25% out of pocket until, for people with very high drug costs, they may reach what they call catastrophic coverage. Catastrophic coverage begins next year at the point that you get to $8,000 in what they call TROOP, T-R-O-O-P, true out-of-pocket cost. So what does that $8,000 include? Everything you pay, not the premium, but everything you pay at the pharmacy, deductible, copay, co-insurance, the 25% during the gap, plus one thing you don't pay, but still counts towards that $8,000. And that is for brand name drugs that you're getting during the gap. You're paying 25%, but what you don't see is of the other 75%, 70% of that cost is a drug manufacturer rebate. Even though you don't pay it, still counts towards that $8,000. And that's good for you because that gets you out of the coverage gap and to the catastrophic coverage next year without having to pay nearly $8,000 out of pocket. For those that reach the catastrophic coverage this year, they pay the greater of either 5% of the cost of the drug or a small copayment, the same copayments that people that have the Medicare Savings Program may pay, because people with the Medicare Savings Program also get extra help. And I want to tell you on the next slide about a change for extra help for next year. So the Inflation Reduction Act, which you might have heard about, made several changes to Medicare Part D. Two that started this year was for how Medicare Part D covers vaccines, including the shingles vaccine, are now covered 100%, and how Part D covered insulin, where insulin is now limited to a monthly $35 copayment. Next year, they're going to expand the extra help. Some people today only have a partial extra help subsidy. Those individuals will be converted to the greater full extra help subsidy in 2024 automatically. And those for next year, for people that reach the catastrophic coverage, instead of paying 5%, they're going to have 100% coverage, which will be a big difference for people that don't have extra help, that have high out-of-pocket costs with their Part D covered drugs. And then the biggest change will begin in 2025. For the first time, there will be an out-of-pocket limit. In the first year, it'll be $2,000, and that number could be adjusted each year. And not only will they have an out-of-pocket limit of $2,000 the first year, but they'll actually be able to spread out that $2,000 across monthly payments over the course of the year. And then some people that have Part D also have the New York State EPIC program, EPIC. EPIC is for New York State residents that are 65 and over, that have incomes of up to $75,000 for a single, $100,000 for a married couple. EPIC works as a supplement to Medicare Part D, and it works with every Part D plan, but it only supplements Part D if the drug manufacturer is participating in the EPIC program. Most every drug manufacturer is, but as of July this year, GlaxoSmithKline stopped participating with EPIC. So for these drugs that you see here that GlaxoSmithKline manufactures, although Part D can continue to cover them, Epic will not supplement Part D to reduce your cost. So if somebody has Part D and Epic and is using a drug manufactured by GlaxoSmithKline, they might have noticed an increase in their out-of-pocket costs as of July this year. And if they want to save, they might want to find out if there's another drug they can use for their condition from a different manufacturer so that Epic could potentially supplement Part D to reduce their out-of-pocket costs. And then for those that are in original traditional Medicare, as opposed to a Medicare Advantage plan that I'll talk about in the next and last section of the presentation, they can choose to have a separate standalone Part D plan for their drug coverage with Medicare. This year, there are 19 of those plans to choose from. Next year, though, it's going to be down to 15 in New York State. There are 2 plans, each from Elixir and from Blue Cross and Blue Shield, that are being discontinued at the end of the year. So if you are in a plan, you're on original Medicare and you have a plan from Elixir or Blue Cross and Blue Shield, you should know that your plan is ending and you would want to look into signing up for a different plan. There's also one of these plans, the SilverScript Choice Plan, where the premium is going up next year. Currently, that plan is a benchmark plan. A benchmark plan is a Part D plan that's available for 0 premium for people that have full extra help, including people that have Medicare and Medicaid and or the Medicare Savings Program. This year, if you have Medicare and Medicaid and you're on the SilverScript Choice Plan, the subsidy the government provides pays the entire premium. So you have a 0 premium plan. But if you're in the plan next year, the subsidy will not cover the entire premium, and you would be responsible for the difference above the subsidy amount. Those individuals who have full extra help, who did not choose the SilverScript Choice Plan, or the government just put them in the plan, they're going to be reassigned to a different benchmark plan. Next year, that will only be 2 in New York, the WellCare Classic and the Cygnus Secure RX. But the people that have the SilverScript Choice Plan, who have the full extra help, who chose the plan, will not be reassigned. And again, if they do not choose one of those 2 plans, they will be responsible for the difference in premium above the subsidy, where today they're paying 0 premium, but next year it's going to cost them for the SilverScript Choice. So let's talk about Medicare Advantage. So far I spoke about one way to get Medicare, original traditional Medicare, which can come along with the Medicare supplement or Medigap plan for those that don't have retiree health insurance and don't have Medicaid. This is the other way to get Medicare, to join a Medicare Advantage plan, a Medicare health plan. This is Part C of Medicare. Nobody calls it Part C, though. These are private plans that are contracted with Medicare to provide all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that take that plan. Okay, these are the companies that are sending you so much mail every day, right? Or that you see advertised, whether it's Aetna or Centers Plan or Elder Plan or Empire or Emblem or Health First or Humana or Metro Plus or United Healthcare, VNS Health, WellCare. Many companies offer those plans. And most everybody's eligible to join. You just have to have Part A and Part B of Medicare, and you have to live in the service area of the plan. That's it. But unlike Medigap insurance, where if you're on original Medicare and you live in New York State, you can pick a plan at any time or switch from one insurer to another at any time. For Medicare Advantage, for most people, there's only certain times of the year that they're able to sign up or switch. And we're in one of those times right now. So first of all, people can enroll in a Medicare Advantage plan when they're first eligible and enrolled in Part A and Part B. If they do not, or maybe they did, but now they want to change plans, most people have to wait till the annual election period. That's every year from October 15th to December 7th. If you sign up for a plan during that time, your new plan starts January 1. For those that are considering enrolling or switching their Part D plan, they could also do this during the same October 15th to December 7th. For those that are in a Medicare Advantage plan at the beginning of the year, there's a second enrollment period. It's called the open enrollment period. Every year from January through March, anyone that's in a Medicare Advantage plan has one additional opportunity to either sign up for a different Medicare Advantage plan or to sign up for original traditional Medicare to switch. One time, January through March, to be effective the first of the next month. And if you do sign up for a Medicare Advantage plan, it's important to remember you're not giving up your Medicare benefits. These private plans are required to cover whatever Medicare covers, plus, as an incentive to join, they will cover to a limited extent some services Medicare does not pay for. So they provide typically limited coverage towards things like dental, towards vision, towards a hearing aid. They might pay for a gym membership fee, all things not covered by Medicare. And some plans are as low as zero premium. You still have to pay the Part B premium, but zero additional premium, and they include the Part D drug coverage. But even if you don't pay a premium, you pay on the other end when you access care. For most services under most plans, you either pay a fixed copayment, a set dollar amount, or coinsurance, a percentage. But in fairness to the plans, although most plans have copayments or coinsurance for most services, it's not an unlimited amount that you're responsible for the year out of pocket. All Medicare Advantage plans have a maximum out-of-pocket limit, abbreviated MOOP, M-O-O-P, not to exceed next year $88.50 in network for all Part A and Part B for hospital and medical covered services. So if you have a plan with an $88.50 limit next year, let's say you're admitted to the hospital and the plan has a $300 daily copayment for the first 3 days in the hospital, that $900 out of your pocket would go towards the $88.50. If you're getting physical therapy and they have a $40 copayment per visit, that $40 out of your pocket goes towards the $88.50. If you reach that limit, most people won't, but if you do, 100% coverage for the remainder of the year for all Part A and Part B, for all hospital and covered medical services. The $88.50 is the highest limit any plan can have in network next year. Some plans have the limit, but more plans have a lower limit. And that's something you may want to compare when you're looking at different plans for 2024. The other thing to compare is the type of plan. In New York City, they're mostly HMO plans, where you're limited to a network of doctors and hospitals that participate in the plan, unless it's an emergency. But there are some companies that offer PPO, Preferred Provider Organization plans. Like the HMO, they also have a network of doctors and hospitals, but the big difference with the PPO, you can use doctors and hospitals that are outside of their network, that don't take the plan, but are still in Medicare. You might have to pay more out of pocket when you do it. You might even have to pay up front and then seek reimbursement from the plan. But for that reason, the PPO allows you more choice, more flexibility than does a stricter HMO. PPO plans also have a maximum out-of-pocket limit for the year, which next year cannot exceed $13,300 combined for in and out of network services. And again, that's the highest limit, but some plans have lower limits, and that's something to compare. And then lastly, for today, I want to talk to you about something that's driving a lot of the calls that we're receiving this fall, and that is with plans that are terminating. So there are people that are in a Medicare Advantage plan from AgeWell, a small insurer, but there are also people that are in a Medicare Advantage plan from larger insurers, Emblem, and from Empire Blue Cross and Blue Shield. Although Emblem and Empire Blue Cross and Blue Shield are still offering at least one or two plans next year, they are discontinuing many of the plans they offer today. And for people that are in one of those plans, it's ending the end of the year. And if you don't do anything, come January 1st, you're going to be on original traditional Medicare. And if you don't have extra help, you're going to wind up not having drug coverage January 1st. So for those individuals that are in a plan that's terminating, you can choose a new plan through the December 7th, but there's a further protection for you. For people that are in a terminating plan, in case you don't choose a new plan by the end of the enrollment period, you're entitled to what they call a special enrollment period. It'll begin December 8th after the annual collection period is over and run through the end of February. So if you know somebody that's in an Empire plan that's ending the end of this year and they don't have extra help and they don't choose a plan and they don't realize until January or February next year when they go to the pharmacy for the first time that they no longer have Part D, it's not too late. They can use that special enrollment period to enroll in a new plan to include Part D, and so that they do not need to be without drug coverage for the rest of the year. If you're looking for Empire Blue Cross and Blue Shield, this year they have a new name. They're using the Anthem name. Okay, but it's the same company it's just a new name for 2024 for their Medicare Advantage products. So I know that's a lot of information in a short period of time, and I'm happy to spend the rest of the time asking questions. And again, just a reminder, you're always welcome to contact us directly at HIICAP for any questions on anything we covered today or anything to do with Medicare and related health insurance. Thank you for your attention.
Well, I told everyone you were an expert on all these issues, and now you have just proved me correct. Thank you so much for
Thank you.
that incredible presentation, verbally and in writing. And now we are going to try to get to some of the questions that have come in. There is no way, sorry, and I did let you go a little longer because it was so important to make sure you got to cover things. And in fact, I think you covered a lot of people's questions, but there's still more. So
Sure.
I'll start rolling. Thank you. Hopefully you got to take a deep breath. Okay, so again, reminder, people can still put additional questions in the Q&A function. No guarantee we're getting to them, but you're still welcome to add them to the list. So if you're 65 or older and you lose company-sponsored health insurance, can you go on COBRA or must you go on Medicare?
Yeah, that's a good question to ask. So what happens is if you're 65 and over and you lose employer coverage, if you've been covered continuously under your active employment since 65, you were okay to delay enrollment in Part B. And in likelihood, they were doing that, especially if they're working for a large employer. But once you stop working, Medicare becomes your primary insurance. So the most important thing for that individual is to sign up for Part B. They will have the option to take COBRA because the former employer needs to offer them COBRA, but COBRA could be very expensive. And instead, unless they're getting some sort of severance package where that's subsidized, they might want to consider one of the choices that we spoke about today, purchasing a Medigap plan and a separate drug plan, or a Medicare Advantage plan, including Part D. And we can help them with that comparison, certainly.
Great. And then a number of people asked, actually over, I guess, typed in questions about the options for switching back and forth between original Medicare, Medigap, and Medicare Advantage plans and the impacts that might have on your costs. So I think it's important for you to clarify switching between original Medicare and Medicare Advantage and how often, your options for doing that.
Yeah, so I'll just review for the enrollment periods. People can switch from original Medicare to a Medicare Advantage plan or the other way around now through December 7th to start January 1st. But in the beginning of the year, January through March, they can only go one way, from Medicare Advantage to original Medicare, not the other way around. Okay? Because that's enrollment period is only for people that are in a Medicare Advantage plan. I did not mention today, though, that there are special enrollment periods. There's always exceptions to everything with Medicare. And one important one is for people that have EPIC. EPIC members are able to make one additional change in how they get the Medicare, Part D and or Medicare Advantage plan outside of these two enrollment periods to be effective the first of the next month. So that's a further protection for EPIC members.
Great, and that was the next question I was going to roll into, and you already knew that and answered it. So thank you.
Sure.
Great. Is there any downside to getting a high deductible Medicare supplemental plan?
Right. Well, the high deductible plan F and Plan G that I mentioned earlier you are saving on the premium. Those plans are much lower premiums, but in exchange, you have to lay out money at the beginning of the year. So some people, that's not affordable for them to have to lay out if they need to be admitted to the hospital over $1,600 or the Part B deductible, and they might want a plan instead that's a little more comprehensive, or to be in Medicare Advantage instead of that. But for other people who are able to lay out the money and are just not anticipating very much in the way of medical expenses, but want to have something in place should their situation become catastrophic potentially during the year, this protects them against having very high out-of-pocket costs. And it does not limit them like the Medicare Advantage plan does to a network of providers. You can use any Medicare eligible provider because you're in original Medicare.
All right. And can you switch between Medigap plans at any time of the year or just during this open enrollment period?
If you're in original traditional Medicare and you have a Medigap plan and you live in New York State, you could always switch. If not with the same insurance company, if you want to upgrade or downgrade but stay with the same insurance company, they might make you wait till an anniversary date, at a minimum every 12 months. But as long as you continue to live in New York, you could always switch, if not with the same company, by getting a different Medigap with another insurance company at any time.
Great. So let's say I have a Medigap program, but then I've learned that I qualify for a QMB program. Should I keep the Medigap plan as well?
That's another very important question, especially this year, with many more people qualifying in New York for QMB because the income limits are much higher. There are people that have just like you described, they have a Medigap plan. Over time, their income has been reduced. Now they qualify for Medicaid and or QMB. And they ask us, sometimes it's their caregiver that's asking us, why should I continue to pay for the Medigap plan? It's expensive when I have Medicaid or QMB. Doesn't Medicaid or QMB supplement Medicare? Well, here's what I tell them. Think about it from the doctor's perspective. The doctor is very happy when you have the Medigap plan, because when you have the Medigap plan, the doctor's going to get the 20% coinsurance. If you don't have the Medigap plan and you just have QMB, the doctor's going to have to write off the 20% coinsurance. And then how much longer do they want to have you as a patient when they have to write off the coinsurance? That might become an issue. So some people, when they have Medigap and they later qualify for Medicaid or QMB, they keep the Medigap just to continue to have access to the most providers. Hey, also, another benefit of having the Medigap is that the Medigap plan, as I mentioned before when we were talking about the Medicare Savings Program, can reduce your income, which for some people, that's how they qualify for Medicaid or QMB to begin with. So that's a further benefit for them. But again, you have to be careful with that Medigap if you later get QMB.
Right, right.
Yeah.
Okay, so let's jump now to the Part D questions. So some people, for whatever reasons, didn't go into Part D earlier. Maybe they had other coverage, maybe they just thought it didn't matter. So now they're a bit older. The example is an 82-year-old who feels they need to add Part D coverage. How big a penalty will they be paying for that? Or is there any penalty for Part D specifically?
Yeah. So for those that don't sign up for Part D when they're first eligible and who choose to sign up later and who don't have the extra help and who don't have other what they call credible drug coverage from another source, like through a former employer or through the VA for veterans, they are subject to a penalty. The penalty is calculated as 1% of the national base beneficiary premium times the number of months they delayed. So the national base beneficiary premium, each year it's varied between $30 and $35. So 1% of that, so let's say 35 cents times the number of months you delayed. So it's not as for people that have not delayed very long, especially, it may not be a substantial premium penalty. But what I think is more important than the penalty itself is the fact that these people may have been at risk by not having Part D drug coverage. So what, because we get some people, sometimes they're new to Medicare, they don't have extra help, they don't have other drug coverage, but they don't want to sign up for Part D because they don't use any drugs and they don't want to be paying for something they feel they don't need. Well, they're taking a chance, right? If in the future they're going to need Part D and they're going to develop some condition and need an expensive drug, they might have to wait in addition to paying the penalty. So what some people might want to do in that situation is just sign up for the cheapest plan possible. And for next year, there's a plan from WellCare in New York that's only $3.70 per month. Okay, and the people, if they don't use any drugs, may just want to have that in place, just to cover them in case they need change in the future. It's not, they don't have to. Part D is voluntary, but that's something they might want to consider.
I think that's a really good lesson for us all, because as we age, we often find that our health needs expand over time, and the medications that are being recommended to us definitely add up more for people, I think the older they get. So I think that's a wonderful recommendation. So people are asking about how this all works with the costs of the different health plans. So one person writes, I'm very confused about changing drug plans. I'm taking a very expensive drug. My current plan is changing to a 25% of cost instead of a set copay for every prescription. The plan has a very low monthly premium and very high deductible. So I'll be facing a pretty big hit when we shift in January to a 25% cost. What do you suggest?
Well, what I would suggest for everyone this time of year is to compare plans, right? To go to the Medicare website, medicare.gov. They have a plan finder search tool where if you enter the names of your drugs, not just the names, but the dosage, the strain, the quantity you take each month, and select the pharmacy, they'll rank all the plans based on your individual needs. And this will help you define if there's another plan that might be covering your drugs at a lower cost. And they're looking not just at the premium, but a combination of the premium and your estimated cost for the drugs over the course of the year. And that if you're not comfortable using the website, you can call Medicare, 1-800-MEDICARE, which is open 24/7. And if you want local assistance, that's us at HIICAP. Our counselors are all very familiar with the website and can do that comparison for you. Even pharmacies, some pharmacies even advertise, they'll do that for you. Okay, we're all going to the same website to make the same comparison.
Great. And people are actually writing in, can they come and meet with a person from HIICAP, or you just do everything by phone?
Most of our counseling is done via phone. However, we do have counseling in person by appointment at the Department for the Aging, which is at 2 Lafayette Street, between Duane and Reed Streets near City Hall. But people can call the same number if they wish to make an appointment. But most all the counseling can be done via phone.
Great. Okay, so years ago, everybody was talking about the donut hole problem. Do we
Yes.
still have a donut hole problem? And let's talk about what that is.
Sure. If you reach a certain amount in drug costs for the year, you get to what they call the coverage gap or the donut hole. So next year, that's a little more than $5,000. I had the exact amount in the slide. So that $5,000, it's not just what you pay, it's the total cost of your drugs. And if you reach that, now you're in the coverage gap. Some people may remember that when Part D first started, people that were in the coverage gap had to pay 100% of the cost of the drugs out of pocket. But they later passed legislation and they reduced it over a number of years. And today, for those that reach the coverage gap, they pay 25% of the cost of the drugs out of pocket until they reach the catastrophic coverage.
Got it.
And starting next year, for those that reach the catastrophic coverage, as a reminder, there will be no cost sharing for you. And your drug costs will be 100%. And again, for people with very high drug costs that don't have extra help, that's a big change for 2024.
So I know you talked quite a bit about Medicare Advantage plans, but can you just quickly explain the differences between a PPO and an HMO
Sure.
Medicare Advantage?
Right. So there are different types of Medicare Advantage plans. The most common are the HMO and the PPO in our area. With the HMO, unless it's an emergency, you're limited to a network of doctors and hospitals. But the difference with the PPO, the main difference is they allow you to go outside of their network to doctors and hospitals that take Medicare, but just don't accept that plan. So it gives you more choice, more flexibility, the PPO for that reason, than does the stricter HMO plan.
And we know that we have specific rules that plans have to use and guarantees when they're in New York. But what if you're traveling out of state, or what if you're one of those New Yorkers who spends the cold months in a warmer climate? Is your Medicare Advantage plan national as far as the coverage you're going to get in other states?
Yeah, right. So that's important to ask too. So with original traditional Medicare and the Medigap plan, you would have the same coverage throughout the United States and its territories. But with the Medicare Advantage plan, if it's an HMO plan especially, again, unless it's an emergency, you're limited to a network of doctors and hospitals. Some plans, their network is just providers in our area. However, there are other plans that have participating providers in other states because they're national insurance companies. So that's something you would check with the individual insurer if you're planning to spend time of the year outside of our area. If you're in a PPO, also be aware that PPO plans can cover out of network for any Medicare provider throughout the United States. But higher cost for out of network, and it's even possible you'd have to pay up front and then seek reimbursement from the plan. So although the PPO plan offers that out of network coverage, it's really only advisable if the doctors you're anticipating to use here or elsewhere are participating in the plan so that you could pay the least out of pocket.
So I know that many older New Yorkers and retirees look forward to spending some number of months of the year out of New York. And I just urge you to be extra diligent in making sure that the choices you're making will actually make sense for you if you need non-emergency health care in some other state. So I know everybody's listening carefully, but I just want to emphasize why I think that's particularly important for people to understand when they're making their selection of best options for themselves.
All right.
Thank you. How do traditional Medicare and Medicare Advantage compare? Because some people think it's a terrible idea and nobody should ever sign up for an Advantage, and other people like the Advantage plans.
Right. So it's very individual, the decision, certainly. And that's the big question. And that's the big thing that we help people to compare. So basically, if for those that are on original traditional Medicare with the Medigap plan versus Medicare Advantage, original traditional Medicare with the Medigap, the big advantage is, like we were talking about, it gives you the most choice of providers throughout the country. You can go to any hospital, they will take Medicare, as do most doctors. And depending on the Medigap plan, it could be very complete coverage between the two. What's the downside? High premium for the Medigap plan, plus doesn't cover your drugs. So you need to buy a separate Part D plan for another premium. So those individuals with original Medicare and the Medigap, they pay the most in premiums, but in exchange, the most choice of providers, the most complete coverage. What about the other choice instead? Why would you choose Medicare Advantage? You save on those premiums. Some plans are available for as little as zero premium, and they include the Part D drug coverage. You don't need the Medigap. You don't have a separate Part D. You save on that end. Plus, you get some additional benefits that Medicare doesn't cover, like dental and vision and the gym membership. What's the downside? If it's an HMO especially, unless it's an emergency, like we said, you're limited to a network of providers. Even if you don't pay a premium, you pay on the other end when you access care for most services under most plans, a copayment or co-insurance up to a maximum out of pocket for the year. Plus, one thing we didn't talk about, it's managed care. So they cover your mental health and your physical therapy and your planned surgery, but you may need to get pre-approval, prior authorization before those services will be covered. So for some people, it makes more sense to have original Medicare with the Medigap. Other people do very well with the Medicare Advantage. And that's the choice for all people with Medicare to make, especially for those that don't have retiree health insurance.
Right. So that helped me clarify the difference between Medicare and Medicare Advantage and drug coverage. So if I'm sticking with traditional Medicare, I still have options for Part D, and that has to be during this open window timeline also of December.
But if you're in original traditional Medicare with or without a Medigap plan, you can enroll in a separate standalone Part D plan. That's one of those 15 for next year that they have, right?
Right.
And you can do so during this annual, if you're not new to Medicare, during this annual period, October 15th to December 7th. And if you do, your plan will start January 1.
Thank you. So the costs are still pretty scary to me as an older person, and I'm worried about the payments. And I think I might be eligible for maybe the Medicare Savings Program or maybe Medicaid along with Medicare. Should I apply for one first versus the other first?
Right. So if somebody needs help with like long-term care, like home care, Medicaid provides very limited, Medicare, I should say, provides very limited coverage for home care. And they might need Medicaid for that. Right? If they just need help with the premium, though, that's the Medicare Savings Program. And that's a quicker and easier application. But it takes some time to process, though. If that same individual also needs help with their drug costs, getting Medicaid or the Medicare Savings Program will give them extra help automatically. But it could be a few months before that everything goes into effect. If their income and resources are low enough for extra help, they can apply separately to Social Security, separate from the Medicaid and Medicare Savings Program, just for the extra help. Because that will get processed much more quickly. They can even do it online on the Social Security website, and they'll go back to the beginning of the month. But when you apply to Social Security for extra help, they're looking at both your income and your resources, as they do for Medicaid, as opposed to the Medicare Savings Program, where they're just looking at income only.
Got it. Oh, this is actually a tricky question I've heard of. So now we have all these new and incredibly expensive drugs, like cancer drugs and trials. Do any of these plans offer catastrophic medical and drug coverage? Suppose you get a doctor who wants to provide you a drug that costs $250,000 a month.
Right. So if they're Part D covered drugs, which are drugs that you would ordinarily be self-administering, that you get at the pharmacy, remember that they have, for those that reach the catastrophic coverage, they're going to, starting next year, they'll have 100% coverage for those drugs once you reach the catastrophic coverage. Excuse me. Some of those drugs, though, that are very expensive, that the doctor is actually purchasing, or the hospital, and administering through infusion, or that are not self-administered, for those individuals, those drugs can be covered under Part B medical insurance. And if you have Part B and you also have a Medigap plan, you could have complete coverage for those drugs, even drugs that are very expensive.
Okay, that's important to know. Thank you. We're almost out of time. Just one more I see that must be a big problem. I just was not aware of it. So people trying to report changes to their Medicare account, and it takes forever to get a person on the phone to report an issue. They want me to talk to 2 other people in the chain of command. Very time consuming, inefficient, waste of time. Is there something that can be done about that? I mean, they're the feds, so it's not you or me, but do we hear about this? The problem?
Right. So if it's an issue with allegation of fraud in the Medicare program, which is what that sounds like, and in New York State, they contract with New York Statewide Senior Action Council to run the SMP, the Senior Medicare Patrol. And they can recall to report any allegations of fraud and abuse in the Medicare program. Or that's who they can call directly.
Okay.
I would recommend. Yes.
Okay, great. Well, you know what, we've hit our time limit. We got through a lot of the questions. One person asked, could you repeat the name of the cheapest Part D plan? When you were talking about that $3.60 a month.
Right. So excuse me, for those on original Medicare with the separate Part D plan, the lowest premium plan is from WellCare. WellCare offers 3 plans for next year, but the one with the lowest premium is $3.70 per month.
Okay, great. Thank you. Okay, now I'm going to officially say thank you, Eric, so much for your time
Thank
with
you.
us today and all your great information. And again, everybody who signed up for today's town hall is going to receive a follow-up email. That also includes an event survey. And so it really helps my office if you fill out the survey, so we know how to just make our webinars better and more helpful to you. Again, everybody had in their chat the phone number for HIICAP. And of course, you will have more questions because that's what this is all about. But HIICAP is there to be incredibly helpful to people because everybody's story is a bit different, as we just heard from Eric. So they have access there in their system to comparing different plans, comparing the needs that you have based on the medications you might be taking, the doctors you're seeing, etc. So I strongly encourage people to take advantage of this really excellent service we have here in New York City. And thank you, New York City, for having HIICAP. And with that, I want to thank you all for joining us. I hope you have a happy Thanksgiving. And remember, COVID, flu, RSV vaccines, and you know, it never hurts to mask up in big groups and in public places. It can't hurt. Anyway, take care, everyone. Bye.